Well, good morning. I was enjoying this. Those of us public health policy nerds love sitting and listening to really smart people talk about things they've learned along the way. I'm going to talk a little bit about first of all where we are with some of our initiatives, but more importantly, kind of where we stand today, given the debate that's happening across our state and across our country. I can't let this go by without commenting a little bit about what happened on Monday in Nashville. People having coverage is important, and I know our legislature understands that. I could cite studies, and I will. The number of Americans who died with a high propensity for being uninsured, according to the Institute of Medicine, is close to 22,000 people a year. The data shows that women who are uninsured end up being diagnosed for breast cancer at stage 3 and 4, as opposed to women who have insurance, who are getting screenings, getting diagnosed stage 1 and 2. We know that you have a nearly double a chance of survival, 5-year survival, if you're insured versus if you're not insured. And I know at the end of the day that ideology will lose to facts and data, and I do believe that that's what will happen. We're going to keep arguing for it. Now, here's the challenge. The challenge is that what happened in Nashville Monday is the good news. There's a lot of other things happening out there that are far, far more important that we also need to look at, that make Monday look like the best day we've had. First of all, there's a lot of discussion in Washington right now that Congress is looking at repealing the sequestration for the military, and I think most Americans probably support that. I know I do. But somebody has to pay for it. The president's already proposed cuts to health care in his budget, and I suspect Congress will take him up on that. When you add that to the $30 million of cuts that mountain states took this year, without the funding that comes from the investment into insuring the uninsured in Tennessee, it's going to have an impact on the financial stability of the organizations in this region, notably mountain states and Wellmont, that both have struggled with these cuts over the last 2 years. I think it's also notable to point out that there was a study released 2 days ago. Full disclosure, I'm on the board of a foundation that is focused on education. And the study shows that in Tennessee, in the next 15 years, the number of children K through 12 is going to increase by 20%, and the number of seniors 65 and older is going to increase by 70%. The number of people in the middle that are working to support those two populations with the competing for the resources, the decreasing resources that are going to be available. K through 12 requires enormous resources and enormous investment. Most people want to see an investment in education K through 12, but then you also have 70% growth in the next 15 years of people over 65, and we know the resources that requires. Today, 55 people per 1,000 or per 100,000, I don't know what the denominator is, but the ratio, I think it's per 100 actually, the ratio of working people to people that are in those other two categories is 55. In 15 years, it'll be 77. The number of people working to support those two population cohorts is shrinking. And it's a big problem. There's a lot of competition for those resources, which makes what we're talking about today so critically important. Perry, you mentioned something, and I'm so proud of the relationship we have with Eastman and the other employers. The number one most important thing we're going to be able to do as hospitals over the next 10 to 15 years is to recognize that we've become a cost center. We are very expensive, and the most logical economic way to improve the performance of the people out there who are trying to create jobs is to make sure that we're working collaboratively with them to make their cost structure as low as possible. Eastman has to compete internationally for their business. And the more money we extract from Eastman to pay for health care here is less opportunity and less investment they have to go compete with the rest of the world so they can grow jobs right here in this region. So we're committed to working in those partnerships, and that's why I'm proud to tell you about some of the things that we've done. Niswonger Children's Hospital and Mountain States Health Alliance a few months ago announced the Morning Mile program. We announced it in Sullivan County, Mayor. Where did the mayor go? Is he here? There he is. Mayor, we announced it in your county. I'm proud to tell you that at the school that we rolled this out in, since we announced it, they've run 1,400 miles. Those kids come, we have a 67% participation rate of kids that come an hour early to school so they can run or walk and earn, every 5 miles, they earn pendants and rewards. And these are kids that are not going to start smoking because they're active. We have one little boy, Giovanni, who's run 21 miles already by himself. We have 2 little boys who are having trouble with attendance. And those 2 kids love running so much, they come to school an hour early so they can run. And guess what? They're going into the classroom, and they're learning. If we want to truly improve the health of our population here, we have to focus on these kids. And that's why, Perry, we've recruited the region's first pediatric endocrinologist. He's here. We're in the process of closing out the contract now. I'm sorry, the first pediatric endocrinologist we've had associated directly with Niswonger. There are families today who meet in parking lots to drive to Knoxville so their kids can have access to endocrinology services. We are also in the process of recruiting a neurologist, a gastroenterologist. We've got the region's first pediatric neurosurgeon that started back in October, Dr. Duco, who we recruited from Cincinnati Children's Hospital, the 3rd best pediatric neurosurgery program in the country. Dr. Duco is here, and guess what? Because he's here, we're now able to take care of kids with epilepsy here right in this region. We didn't have that opportunity before. And people's donations from the community help provide the resources to do that. So we are thrilled with the progress that we're making with the support of folks like the people in this room. If we're going to improve the health of these kids, it starts with making sure the resources are there, and it's primarily important to make sure that they can read at grade level by the 3rd grade. That's why the other thing Niswonger Children's Hospital is now invested in is the Teen Trendsetter program. We're actually working with the Washington County schools, an elementary school and a high school, where we take teenagers from the high school to the elementary school, and we work with kids in the 1st and 2nd grade who are 6 months behind in reading proficiency. Why? Because good health ties directly to literacy. And we've got to eliminate this problem of functional illiteracy. If we want kids to grow up and be healthy, it starts with them being able to read at grade level by the 3rd grade. Before the 3rd grade, they learn to read. After the 3rd grade, they read to learn. And if they're not at grade level, they fall further and further behind. And that's why Mountain States Health Alliance we don't draw a black line between education and healthcare. We think the 2 are very closely aligned, and we're deeply committed to investing in that. I heard some discussion about rural hospitals. There's no doubt the role rural hospitals play in this region. There are 2 rural hospitals in this region that Mountain States Health Alliance subsidizes today that lose money. And we're going to continue doing that because we understand that those access points are critical. If those, first of all, they're job creators, but second, for those communities, and to create a downward job spiral in a community is not helpful to the health of a community. 2, we believe those access points are critically important. Who can't travel for health care? Poor people who don't have transportation. So we only compound the problem of public health if we take that initial access point away from them. So we're committed to these rural communities and these rural hospitals, and we're going to continue to invest in them. That's why in the last 5 years, we've invested $400 million in these rural areas in Southwest Virginia, because we understand that those access points are critically important, and we're going to sustain those. The landscape is changing very dramatically. The number of cases of community-acquired MRSA that comes into the hospitals, the sepsis, the increasing resistance of these bugs to the drugs that we've been using historically, these are all changing the face of how we deliver care. And the best way to deliver effective health care is to keep people from getting to the point where they need to be admitted to a hospital. Now, that sounds pretty instructive coming from somebody who runs hospitals. But it gets to a larger issue that's occurring throughout the country right now. We're overbedded. We have too many hospital beds. In this region, we have 124 hospital admissions per 1,000. The national average ranges from 676 to 110. We admit more people in this region per 100,000 than most places in the country. And that number's dropping. As those numbers drop, and as reimbursement continues to drop, as I mentioned before about the decreasing availability of public resources, as those things occur, our systems face an incredible challenge because of all of the hard physical assets that we've invested in that are redundant and duplicative. This is playing out all over the country. And I think what I'm hoping for is that we can come up with a solution that's good for this region and that's not imposed on this region. And I think that hopefully that can happen. But it takes leadership of people like the folks in this room who understand that public health and health care is not just simply bricks and mortar. It's all the things that have to happen upstream. Healthy kids going to school and learning how to read and do math. Now, I mentioned earlier a little bit about ideology. It's no secret I've worked for 2 conservative Republican governors. And I remember the issue of transparency. Perry, I keep mentioning your name. You threw a lot of good stuff out there, my friend. Transparency is a big deal. In 2004, Governor Bush and I were talking, at the time I was his health secretary, what's the most important transformative thing we can do in health care? We said transparency. So we went to the legislature and we asked them to let us publish a website comparing hospital outcomes on the internet, cost, complications, infection rates. The hospital said, no, you can't do that. It doesn't work. We're all different. We treat sicker people. You've heard those arguments. We said, that's all fine and good, but we're doing it anyway. And the legislature passed it. We started using risk adjustment methodologies, and now, subsequent to that, we started, it raised a lot of questions. The federal government started asking us, how did you do that? Before you knew it, there was healthcare, there was the Hospital Compare website on the HHS website 3 or 4 years later. And now today, that idea of transparency has become value-based purchasing, where the public and employers can see how health systems are performing and reward their behavior with the proper financial rewards for success, and saying we're no longer willing to pay for poor quality. We're no longer willing to pay for 7 linear accelerators in a region that may need 3. We're no longer willing to pay for new bricks and mortar when we don't need that. What we need is upstream investment in avoidance of poor health. And so we've got to start listening to our employers and listening to the government when they say we aren't doing this anymore. And we're prepared to do that. Mountain States Health Alliance, our board has consistently and unanimously said we're ready to do that. We're ready to set aside the past and move forward to a future where we recognize first and foremost we have got to help our employers reduce the cost of health care for their employees so they can go out and do the things we all want them to do, namely create jobs. So that our folks, there's no better public health than an educated family who's working and bringing home the income to support and grow their family so they can enjoy the American dream of rising. And that's what Mountain States Health Alliance is about. We're not just a bunch of hospitals trying to do what hospitals do. We're trying to find a better way to partner with this community. I'll close with this because I know you've heard a lot. My mother died when I was 6 years old. She died, and I'll talk about this a lot, she died from an aneurysm. I woke up one day, actually one night we were at a concert at my sister's school. She was in the band. My mother stood up to stretch, and my dad asked her, where are you going? She said, I just feel a little bit dizzy, I'm going to go for a walk. Next thing I know, she was falling down the bleachers. She passed out. She died the next day. And I was 6 years old, I was sitting in the hospital, and I said, you know, I'm going to be a doctor because one day I'm going to do what I can do to help other kids not lose their mom. And I'm not proud of the fact that I did take chemistry in college and I failed it, so that's why I'm not a doctor, by the way. But the part that gives me passion is when I walk around the halls at Johnson City Medical Center and I walk around the halls at Indian Path or Norton or Johnson Memorial or Unicoi or any of our other assets, inpatient or outpatient, I'm surrounded by people who are as passionate as I am because of their own personal life experiences. And that's why I have nothing but optimism. I have nothing but optimism for where the future is taking us, because the people inside those hospitals and the people inside Mountain States have every bit the compassion I do and the passion I do because of what shaped their own experience. They grew up here, they live here, and it'll be over our dead bodies that we're going to give up control of that to somebody from somewhere else. That's how we feel about it. These are our assets. You are our family, and we are yours. This week, we're continuing something. I'll tell you one other thing. There's been a lot of news, and I mentioned ideology earlier. We talked about ideology as it relates to health care, and it's a shame, but it's real. There are people that fundamentally distrust the government, and I understand that. I'm one of them sometimes, most of the time, actually. But government partnerships with the private sector work. In Louisiana, We decided that there were too many kids not getting immunized. We partnered with physicians in the business community and Walmart. They came and we did a joint deal, and we went from ranked 44th in the nation in child immunizations to ranking number 2 in the nation in just 2 years through a partnership between the government and private sector. Ideology is also having an impact on education. Higher standards are the way to get where we need to go to make sure our kids are competitive and come out of high school career or college ready. We can't let ideology stop our progress in ensuring that we hold our kids to high standards and that we make sure that they're competitively ready for a job when they come out of either high school or college or vocational training, depending on what's best for them. It's important as public health experts that we don't let ideology trump what we've been trained to do, which is to talk about facts, data, and just keep focusing on the things that we know will improve the quality of the life of the people in our state. And it's not just because it feels good, it's because it's economically the right thing for our state. It helps us grow, it helps us add jobs, and it helps us become better as a state and as a society. So with that, I just want to say thank you for this day, Brian. I want to also say our prayers are with Dr. Jim Gibson. Many of you know him. Today is his memorial service. He's a wonderful man, and his wife Dottie is a tremendous lady. They're huge supporters of ETSU and healthcare in this region. I also want to say a prayer, and I hope you'll all say a prayer for Congressman Rowe. He and his family are going through a difficult fight right now. He's a good man, and he's personally touched and helped so many people. I think if we can lift our prayers up for him and his family, it'll mean a lot to him and to Pam and their family. So with that, thank you, Brian, for doing this today. You've done such a superb job, you and Donna, of leading the efforts in healthcare in this region, and we're proud of the partnership. Thank you.